circle of peace. Circle of peace. Circle of peace formation from anterior and posterior. Formation from anterior cerebral, left and right, between of bifurcation or communicating artery. Anterior formation from anterior is anterior anterior communicating artery. Okay, communicating artery between this artery. Communicating artery. Okay, and this artery internal carotid artery. Okay, internal carotid artery. Internal carotid artery, and this artery vertebral right, vertebral left, communicating, and this is basilar artery. Basilar artery branch artery posterior. Posterior cerebral artery, posterior cerebral artery between of the vertebral, the internal, okay, internal branch from middle cerebral, internal carotid artery, branch between of the medial cerebral artery and posterior cerebral artery, this artery and this artery posterior, okay, posterior, communicating, okay, artery. Between of the anterior cerebral, between of medial, this artery, and anterior cerebral. Anterior cerebral artery, anterior cerebral artery. Location, inferior surface of the hemisphere. This circle of the release formation, any branch formation from anterior cerebral artery, formation to anterior communicating artery, okay, formation from a medial cerebral artery is middle cerebral artery. Middle cerebral artery, but this is artery formation from a circle or no? Or not? Okay, this artery not, okay, formation of circle, okay, not medial, okay, and three internal carotid artery, internal carotid artery, three posterior communicating artery or posterior communicating artery, posterior cerebral artery and basilar artery. Okay, all of artery formation 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6 artery. 1, 2, 3, 4, 5, 6. Formation of circumflex. Situated of circumflex, inferior surface of the limbs. Okay, all of branches, blood supply of the brain. Very important. This is very important circuit of the brain. Okay, cerebral arterial circle, VLS vessels dissected out. Okay, anterior formation from anterior cerebral artery, okay, anterior communicating artery, internal carotid artery, posterior communicating artery, posterior cerebral artery, and basilar artery. All of branches distal, medial, or recurrent artery of Abner. Recurrent artery of Abner branches which artery? Anterior cerebral artery. Okay, anterior cerebral artery, recurrent artery of Abner. Hypothalamic artery, anterolateral or lenticulostriate artery, posterior location of cerebral arterial circle, vessels in situated inferior view of the cerebral, inferior view of the cerebral, inferior view. Okay, inferior view of the cerebral, anterior communicating, anterior cerebral, and internal carotid, posterior communicating, posterior and basilar. Around of the chiasmatic sulcus. And this is adeno-hypophysis anterior lobe of the pituitary gland. Pituitary gland situated which fossa? Okay. And another origin and distribution. Distribution, what's the meaning distribution?
Divide.
Okay, distribution, okay. Distribution branches of the artery, central artery, anteromedial group, anterior cerebral and anterior communicating artery, anterior perforated substance. Anterior perforated substance formation from which artery? Anterior cerebral and anterior communicating. And origin is central artery, anteromedial group. Origin from two arteries. Structures, anterior blood supply, anterior hypothalamus and preoptic area. Anterolateral group or lateral striated artery mean from medial cerebral artery, anterior perforated substance, and head of caudate nucleus, which are the structures of the blood supply by anterolateral group or medial cerebral artery, head of caudate nucleus, blood supply, putamen, lateral part of pallidum, internal capsule anteriorly, geno and part of posterior limb, external capsule, clastron, lateral hypothalamus, and posteromedial group and posterolateral group. Posteromedial group, posterior cerebral and posterior communicating artery, thalamus, anterior and medial part, subthalamus, hypothalamus, all are part, blood supply by posteromedial group and thalamus, posterior part, and lateral part of cerebral peduncle, innervated blood supply by posterolateral.
Head of caudate nucleus supplied by recurrent nerve.
Recurrent artery or hub nerve. Okay.
Head of caudate nucleus. Here, middle.
Middle.
Here, middle.
Here.
Last slide, sir. Last slide. Previous slide.
Okay, this is slide.
Yes, sir. Head of caudate nucleus. Lateral stereo artery.
Head of caudate nucleus. Head of caudate nucleus. No problem. Anterolateral group. Hub nerve part of the anterolateral. Hub nerve and anterostriated and precallosal and callosomarginal formation. What group? This group anterolateral. Okay. Venous supply of the brain. Venous supply. Venous not very important. Okay. Venous external cerebral veins. Venous low oxygen. Okay, the blood. Venous supplied by external cerebral vein and internal cerebral vein, two groups, internal and external. Okay, venous supply, any group, two group, external cerebral and internal cerebral. External cerebral contains the superior cerebral vein. The superior cerebral vein. Superior cerebral vein. And superior anastomotic vein. What's the meaning? Anastomotic.
Which anastomosis?
Okay, connection joint. Okay, joined by superficial medial cerebral vein and inferior anastomotic. Superior anastomotic and inferior anastomotic. External cerebral vein, superior cerebral vein, superficial medial cerebral vein, and deep medial cerebral vein. Contains two groups. Deep and superficial and internal is internal. Deep medial cerebral vein, anterior cerebral vein, this anterior cerebral vein and deep medial cerebral vein, formation of the basal vein. Basal vein formation from which veins? cerebral, anterior cerebral vein, okay, communicating by
deep middle
cerebral vein, communicating between of the deep medial cerebral vein and anterior cerebral vein formation. Another vein, this is vein, basal vein. Okay, basal vein anastomotic by internal cerebral vein, then formation greater cerebral vein or Galen. Another name of Galen. Okay? Vein, anastomosis by anterior cerebral. Okay, anterior, medial cerebral. This vein, very important vein. Big, not superficial. Medial cerebral vein and anterior formation of the basal vein. Okay, medial, deep, not superficial, cerebral. Formation from by which anterior is anterior cerebral vein. Okay. Formation which vein? Basal. Okay. Basal vein. Basal vein formation, but which? Internal. Okay. Internal cerebral vein. Internal cerebral vein. Internal cerebral vein. Internal cerebral vein. Formation of which artery, which vein? Okay, great cerebral vein or Galen vein. Galen vein, important. Galen vein formation striate sinuses. Galen vein, vein of Galen or Galen vein. This is greater cerebral and Galen vein. And the thalamo-striate vein. Thalamo-striate vein communicating by choroidal vein. Thalamo-striate, okay, anterior thalamo-striate vein, okay, joined by which part? Thalamo-striate vein or vena terminalis joined by choroidal vein, and thalamo-striate joined by thalamo-striate joined by joined by which vein? Choroid vein. Choroid or choroidal cephal vein. Formation of the anterior cerebral vein. Anterior formation of the internal cerebral vein. Internal cerebral vein communicating by basal vein. Formation gray cerebral vein. Okay, gray cerebral vein.
Sir, can you repeat this one? Thalamo-striate vein and choroidal vein.
Very easy vein. Anterior cerebral vein, formation from thalamo-striate vein and choroidal vein. two choroidal vein
Joint
formation
together.
internal, okay, internal, and middle formation of the basal, internal and cerebral, basal and internal cerebral formation of brain. Protected by 3 layers. This brain, covering by any layer, 3 layers. Dura, matter, arec, noid layer for matter 3, here, matter. Dura matter covering of the lateral surface contains 2 layers. One, meningeal layer. 2, 1, Christian layer. Christian layer 2 meningeal contains 2 layers. Lateral layer Christian, okay, medial layer meningeal, and external space of the dura mater, extradural space. Okay, extradural space. And another layer, intermediate layer. This space, subdural space. Okay, internal dural, sub 1, 2, subdural space. And this part, inferior surface of medial surface of arachnoid, subarachnoid space, subarachnoid space. Okay, and medial surface, this surface, pia mater. Okay, pia mater covering of just all of brain and sulcus and hemisphere and gyrus. Okay, pia mater, this medial space of pia mater, pial space, subpial space for subpial space. Okay, subpial space. Hemorrhagia, external hemorrhagia, external dura mater hemorrhagia. Okay, this space subdural hemorrhagia, subarachnoid hemorrhagia, subpial hemorrhagia, very difficult hemorrhagia, and leg of death. What's the meaning leg? Leg of the death. Okay, this mad. Pia sub death. Subpial hemorrhagia, very difficult hemorrhagia, and dangerous hemorrhagia. This one. Okay, dura mater, arachnoid, pia mater, extradural, and meningeal nerve supply. This part subdural hemorrhagia, tearing or rupture. What's the meaning tearing? Tearing. Okay, tearing, the same of tearing? Parikardan kişiden. Okay, rupture. What's the meaning? Okay, rupture پاره شدن. اوکی؟ خون ریزی. اوکی؟ This is a tearing of middle meningeal artery, tearing of middle meningeal artery, hemorrhagia, extradural hemorrhagia, extradural hemorrhagia. Okay, but tearing of internal cerebral subpial hemorrhagia. Which artery numbers of the tearing or rupture? Which artery of cerebral?
Middle.
Very good. Middle. Middle. Okay, middle artery. All of hemorrhagia from tearing of the middle cerebral artery. Okay. Protective. Protection, brain protected by which structures? Three layers, dura, arecti, pia. Okay, protective or protection. The brain from the outside is the brain and the spinal cord are protected by meninges. Okay. Meninges, the three layer, dura mater, outermost, okay, touch, continue with pristium, contains two layers, meningeal and pristium, okay, meningeal and pristium. And another arachnoid matter. Arachnoid matter middle layer as either web appearance. What's the meaning appearance? As okay, shabaki. Okay, for perforated. Okay, but pia matter innermost layer not visible to naked eye. Okay, and the arachnoid matter free blood supply. Which layer pre-blood supply? Arachnoid. Diffusion, okay, nutrition by diffusion. What's the meaning diffusion?
Higher concentration to low concentration.
Okay, diffusion. Which layer of the brain free of the blood supply? Okay, arachnoid. Okay, arachnoid. Dura mater. Speak is okay. Repeat. Ta and layer. Okay, khashen. Okay, hard and most superficial contains two layers: peristeal, attached or attachment to the skull, attached. Okay, joined by, okay, and connection by, okay, attached, attachment, and meningeal true layer, external covering, extends. What's the meaning extend? Okay, extend, okay, downward and surround the spinal cord, downward. Extend downward of spinal cord and surrounded or covering of the spinal layer, and in several locations the inner dura mater extend into the cranial cavity, forming a sheath that leads inward and then returns. Okay, these dura folds, dura mater formation any folds, child, folds, okay, folds, okay, folds, provide additional support for the brain. Dura sinuses between of the two layer of dura mater, formation of space fossa this space fossa. Another name sinuses, dura sinuses. Maybe, okay? Formed between two layers. ممکن است maybe between form two layer. Peristeum between of the peristeum and the meningeal layer. Between of the peristeum and meningeal layer. Okay, fossa space. This is space sinuses, dura. Okay, dura folds, flux cerebri, dura folds, flux cerebri. Okay, and tenterium cerebelli, flux cerebelli, sella diaphragm. Dura folds, all of structures. Dura folds except. Okay, flux cerebri, tenterium cerebri, flux cerebelli, sella diaphragmatic, sella hypophyseal.
Sella hypophyseal.
Okay, sella diaphragmatic. This is dura. Dura. This is a false. This one false. Okay, false anterior. Anterior in attachment to crista galli. Crista galli. This is falx cerebri. Falx cerebri. What's the meaning? Falx. Arrange. Falx cerebri. Okay. Another name. Falx cerebri. That Farsi array. That Arabic. Okay. Arabic and
Array.
Array. Okay. Das.
Chat pe array.
Falx cerebri. Between of the left and right hemisphere. Formation from dura mater. Which layer of dura mater? Meningeal layer. Okay? Meningeal layer. This is this one. Falx cerebri. And this is falx tenterium. Tenterium cerebri and sinuses. Superior. This superior sagittal sinuses. Superior sagittal sinuses. And this inferior sagittal sinuses. Sinuses between which layers of dura formation? Between which layers? Okay, and this superior sagittal sinus, superior sagittal sinuses, and the superior border of the falx cerebri. Formation of superior border of falx cerebri. Inferior border of falx cerebri. Formation of which sinuses? Inferior sinuses. Inferior. Okay. This inferior sagittal sinuses. Inferior sagittal sinuses joined by great cerebral vein or vein of Galen. Inferior. Sagittal sinus and vein of Galen, another great cerebral vein, join this sagittal sinus and Galen formation from striate sinuses. Okay, striate sinus. This is striate sinus. Striate sinus. Okay, this inferior sagittal and Galen. This is great cerebral vein or Galen formation of striate sinuses. Okay, striate sinuses. Striate sinuses and transverse and superficial communicating or joint formation confluent sinuses. Okay, which sinuses formation, then jointing, then formation of confluence,
Straight sinus.
okay, straight, superior sagittal, and right transverse sinuses. 3 sinus. Okay, striate sinus. Striate sinus joined by striate sinus joined by superior sagittal sinus and transverse, right transverse sinus, and striate sinus, upper part superior sagittal sinus, formation of the confluence of sinuses. Confluence of sinuses formation from any sinus. 3. Straight,
Straight sinus.
right transverse, and superior sagittal sinuses. This is this dura tenterium cerebri. This tenterium cerebri. Sinus cavernous. Sinuses of the brain, sinuses cavernous, sinus inferior petrosal sinus, superior petrosal sinus, left transverse sinus, straight sinus, confluence sinus, and parieto-sphenoidal sinus. All of sinuses of the brain, superior sagittal sinus, inferior sagittal sinus, striate sinus, left and right transverse sinus, superior petrosal sinus, inferior petrosal sinus, and sigmoid sinus, final sinuses, sphenoparietal sinus. Sphenoparietal sinus. Okay? Sphenoparietal sinus. All of sinus. Superior sagittal sinus, sinuses of the brain. Superior sagittal sinus, inferior sagittal sinuses, striate sinus, transverse sinus, left and right, sigmoid sinus, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, sphenoparietal sinuses. All of sinus of the dura venous sinuses, sagittal sinus, inferior sinus, striate sinus, transverse, left and right, and sigmoid sinuses. Superior, okay, cavernous sinus, striate sinus, superior sagittal sinuses, confluence sinuses. This part, confluence sinuses. Confluence sinuses formation was very any sinuses.
Straight sinus,
Straight,
right
superior
transverse sinus,
sagittal,
superior sagittal
right.
sinus.
Okay, very important this confluence sinuses. Okay? Very important. Okay, and the cavernous sinus, coronal, slightly oblique section through of middle cranial fossa, showing what's showing? Nishan midat showing. Okay, nishan the cavernous and cerebral portion of the internal carotid artery and the cavernous sinuses. Cavernous sinus, this is this sphenoid sinuses and sella torsica, hypophyseal. This kind, this sinus, cavernous sinus. Cavernous sinus contains lateral surface or lateral wall, not surface. Lateral wall, this lateral wall, and medial wall, and anterior wall, and posterior wall. Okay, lateral wall of the cavernous sinus lateral wall of the cavernous sinus, relation by any structures. Relation by any structures. Sphenoid. Okay, sphenoid, lesser wing, greater wing, petricoid lateral plate, and medial plate. Okay, body, cella toxica, is part hypophyseal gland, stalk of hypophyseal, covering by tenterium cella, diaphragmatic cella, diaphragm, okay, and the left side and lateral side of body of sphenoid located of the sinuses. Which sinuses? Which sinus? Cavernous sinus, okay? Cavernous sinus, internal of cavernous sinus, internal carotid artery. Internal carotid artery. And inferior, posterior part, abducens nerve. Abducens nerve, internal. This cavernous sinus. Cavernous sinus. Okay? Cavernous sinus. Internal carotid artery. Lateral wall of cavernous sinus, relation by any structures. 1, 2, 3, 4. One, two, three, four. One, relation by lateral wall. This cavernous lateral wall, medial wall, anterior wall, and posterior. Okay? Inter of the cavernous contain two structures. Internal carotid vein artery and the abducens nerve. Okay, and lateral wall relation by any structures. 1, oculomotor nerve. 2, trochlear nerve. 3, ophthalmic nerve. And 4, maxillary nerve. Okay. Lateral, all of the structures relation by lateral wall of the cavernous sinuses except mandibular nerve, trochlear nerve, oculomotor nerve, ophthalmic nerve. Mandibular emerged by oval foramen. Okay, oval foramen. Did you understand this part? Very important. Okay. And another. This part. Okay, wall of the wall, lateral wall of the brain. This one oculomotor nerve, trochlear nerve, ophthalmic nerve, and maxillary. Internal carotid artery and abducens nerve. Okay? And arachnoid and pia mater. Arachnoid and pia mater tight joint named leptomeninge. Okay? Arachnoid. Arachnoid layer and pia mater layer. Okay, 2 layer tight jointing. Okay, type, connection type, join. Two layer name is leptomanenge. Which layer name? Which layers is leptomanenge?
Arachnoid and
Which
pia.
layer?
Right and pi matter.
Okay, arachnoid and pia matter. Okay, two layer jointing type. What's the meaning type?
Tied.
Type jointing. Okay, then formation of leptomanenge. Leptomanenge formation from any layer arachnoid and dura matter. Arachnoid and pia matter and dura matter. Pia matter and diaphragmatic dura matter and pia matter and arachnoid. Pia matter and arachnoid. Okay. Arachnoid loves a spider web of connective tissue. Hence, it is the sub-arachnoid space filled with blood vessels and cerebrospinal cord, free blood supply, and thinner layer. What's the meaning? Hence, what's the meaning? Hence, this is what it is.
Beneath.
Hence, it is the subarachnoid space.
Beneath.
Pain, okay. Hence of pain, subarachnoid space, pia mater. The deepest and most delicate, okay, covers the brain tissue and sulcus. Follows its very rich and groove. Follow of groove. Okay, enter of the groove, pia maters. And what do you call, okay, an inflammation of the meninges? What do you call of the inflammation of the meninges? Meningitis. Okay?
Meningitis.
Meningitis. Okay? Meningitis. What do you call an inflammation of the meninges? Meningitis. I-T-S. Meningitis. Okay? And the spinal cord will layer the same of brain, dura mater, central canal filled with cerebrospinal, and the spinal cord anatomy. Okay, contains three layers: dura mater, pia mater, and arachnoid. Meningeal of the spinal cord, dura mater, arachnoid, pia mater. The same. Okay, this part. Okay, finish. Okay.